Very informative, and it's great to see those studying has been done, and it really gives us the very good roadmap what we can do by using the data, by understanding the power of the data. So now let's turn into Dr. David Bychkov.
Welcome, everyone. Thank you very much for attending our lunchtime presentation. Again, my name is David Bychkov. I work together with Dr. Young at UCIPT. I'm also a professor at the New School in New York. And what I want to do today is I'd like to give everyone an opportunity to learn a little bit about how we procure the data that fuels the research that makes it possible to do what Dr. Young does and what our team at the Institute does. I think probably many of you were excited to see what we were able to do with CHP, what we were able to do with just that little bit of data from CHP, and what we were able to do with Waze. And in fact, the Institute does that all the time with the CDC and all the time with the NIH and federal agencies. And so what I want to tell you as the person who's probably most responsible at the Institute for bringing together data sets, I want to tell you a little bit about our process at the Institute and my process as someone who works with Dr. Young to help him vet and find new data types. And then after I do that, I'll tell you a little bit about how we interacted with CHP, how we interacted with Google, and what that looked like, so that you might be able to imagine putting yourself in the shoes of working with a partner like the University of California. So, first of all, I want you to know that there are three different groups that have data, generally data sets about citizens. If they can learn to share, the public will win. Before I tell you who those groups are, let me tell you a little bit about what kind of data for us as people working in behavioral psychology, what kind of data sets that we actually are interested in finding. First of all, there are data that individuals record about themselves. We can think of them as like diaries. So for example, all of us just ate lunch. After I was done eating my lunch, I went into MyFitnessPal and I entered my calories. That process of diarying is something that in a clinical trial is recorded, and that's something that academic researchers would have, and certainly it's something that's controlled through an IRB process. That's not something that a company would have necessarily access to, or a government would have access to, but a clinical trial researcher would have access to. Another kind of data set that would be very valuable, it would be surveys. And those surveys would be, for example, the census, right? That's a very important kind of survey that you might be aware of, and that's published and available. Another kind of survey that would be extremely valuable would be the HCAHPS. HCAHPS survey is something that's used to monitor hospital quality. And that's something that's controlled by the federal government, coordinated by the federal government, and is used to regulate Medicare, Medicaid disbursements. Digital behavior. That kind of data is publicly available. We were talking with Russ about Twitter. That's an example of something where a human being communicates or kind of leaves some kind of footprint. That's an obvious one. Another one might simply be their bank statement. So there are very different levels of digital behavior, from something that's public domain to something that's quite privately controlled, all the way down to personal information that simply cannot be communicated, let's say, without a subpoena. And then there are things like health outcomes, admission, discharge, transfer data that requires patient consent and so on, or things that are published as part of CMS, Medicare, Center for Medicare and Medicaid's published reports at the end of the year. So it depends how granular you want to go, but generally those are data that are available about citizens, and they aren't necessarily shared. If they could be shared, everyone would win. So government agencies are one of those groups, certainly, and their mission is to satisfy their taxpayers. That's certainly a reasonable thing. And another group would be Social media platforms, companies like Google, for example, they have a massive amount of data, and they need to satisfy their customers, which tend to be their shareholders and advertisers. They have a profit motive, which is very different from government agencies, which have a cost savings motive for their taxpayers. And then another group are people like Dr. Young and myself. We're public health researchers. Our target is to have an impact. Generally speaking, our target is to save lives. We are nonprofit by nature. We're funded by grants. We're funded by donations. We're a middle ground, but we certainly don't have a profit motive. And the taxpayer is certainly important, but it's not exactly the same. We're trying to save not trying to save the money. We're trying to save their lives. It's a different thing. So now let's talk about public health and safety. Let's talk a little bit more about what gets Dr. Young and me and our team up in the morning. What kind of gets us going. So one of the things that we try to think about is how can the CDC, NIH, the people who give us grants, how can they get out the best possible information to the general public? So for example, Dr. Young was talking about the CDC, and one of the challenges that they face is that he was mentioning, for example, they're not going to have their final data about HIV until possibly 2020. For the year 2016. Well, that's not only in the case of HIV, that also might be about other topics. So, and certainly other departments have those issues. For example, the Department of Homeland Security, they are frequently polling all kinds of data, including online chatter related to terrorism, to decide their Homeland Security risk system. The Amber Alert system relies on a variety of things. I'm sure CHP and other law enforcement agencies could speak much better than I can. I'm sure Commander Song can speak about that much better than I can, about how they update that and what goes into updating those things. But it all boils down to how quickly can you do that, and then ultimately how can that be relayed. Now, mass media, people like Adam's company, Google, they don't collect that data. They simply regurgitate. The government is the gold standard for that data. So whatever is cranked out ultimately by CHP or the CDC or any government agency is simply going to be regurgitated, is going to be relied upon. Now, the next issue that becomes sort of important in public health researchers, we study, this is one of the things that we are looking at, is what happens when agencies are looking to each other. They have this information they've generated and they communicate with each other. What happens to the public when that happens? And the other thing that happens, of course, that's important to understand is that this information may be generated not in real time, but maybe on some quarterly basis. Not all information, of course, is necessarily real time. And that these delays obviously may make it difficult for people like Dr. Young or myself to actually do anything of research value. Nevertheless, one of the things that Dr. Young pointed out, if you look at the basis of his research, or of any of the things that he brought up, you may notice that the gold standard, the thing that we test, whether it was Waze or any other Twitter or Facebook data, what was he testing all of it against? He was testing it against CDC data. He was testing it against CHP data. In other words, when we start with something experimental, we test it against what we consider to be the truth, or something as close to the truth as we can get it to be, something that's proven to be observed. That something that was observed is usually something from the government. And so regardless of how the information is assembled, once a government report is published, it is treated as the gold standard for our studies. And so when we try to devise new treatments or products, as Commander Song pointed out, in the past, I myself, I'm an entrepreneur, I've developed my own wearable devices. Anytime I've ever developed a wearable device in the past, the onus has always been on me to try to prove that it was somehow better or more useful and at least as safe as some predicate device that has already been approved by the government. Well, the same is certainly true of any new process we've ever tried to introduce, anything experimental. We have to compare it against the gold standard. So Dr. Young and I work together to find new data types that can more quickly predict patient outcomes than government-issued reports. In the case of CHP, those patient outcomes have to do with What is the time it might take to get a potential patient in a traffic accident to a hospital? That is in fact why we were excited about CHP data. Because you might be asking yourselves, why would Dr. Young, someone who works at a medical school in the Department of Family Medicine, and Dr. Bychkov, someone who works on biosensors and who wrote a book about placebos, go to the California Highway Patrol? What are they doing here? Well, the answer is because if you really want to understand outcomes, there is something quite clear as far as outcomes are concerned if someone has been in a car accident and it is labeled as having an injury. That is a very clear outcome. So the California Highway Patrol was a very logical place for Dr. Young and I to go. So just to summarize some of the challenges that exist for researchers as someone who has to go and procure data and as someone who has to try to bring data to Dr. Young and to the Institute. Thinking about the gold standard data are not universally digitized or accessible. So one of the things, for example, I spoke to a very interesting person today who works in research at the California Department of Corrections. He was very interested in pointing out to me some data that's published by the department, but it was prepared in a PDF format. And that's exciting and wonderful, but it's not something necessarily that was available with an API, or wasn't necessarily available with comma separated values. And it wasn't necessarily provided with documentation that researchers might necessarily know what to do with. So that's something that, for example, might be very costly for researchers to try to take it, make sense of it, compile their own documentation to try to understand what was that gold standard. So even though there may be a gold standard, the gold standard may be such that it's simply unusable. Or it may be that a FOIA request is necessary to get at the gold standard. In other words, a researcher, and this is certainly the case with journalists, who are another kind of researcher, would have to go to the government and compel the government to provide the background information to understand what that gold standard is. Now, that's the other issue, is that there may be a gold standard, but it's been compiled on an annual basis or a semi-annual basis. So if we were to compare it against some experimental data, for example, Dr. Young, he might say, I had the ability to improve some data set by comparing it to social media data, which that social media data is available by the millisecond, but the gold standard data is only available on a daily basis or a weekly basis or a semi-annual basis. There simply may not be enough data points to correlate, to do some kind of an analysis. So if there's not enough data sets for correlation, not enough frequency, the gold standard simply just doesn't enable an analysis. So there's just nothing to be done, unfortunately, in that situation. And if the agency is simply not willing to provide enough background information or digitize their information or cooperate, simply nothing can be done. Let me give you a classic example of this. I did my postdoctoral fellowship at Johns Hopkins University, which I would say is one of the largest recipients of NIH grants on the planet. I don't work there anymore, so I'm not ashamed to say, and I know this will be broadcast on YouTube, that in the attic at Johns Hopkins Hospital, there is a huge room of documentation of all of the machines they have. And all of the documents, the document room for all of the stuff that's supported by NIH grants is basically this place where all of the paperwork is just on the floor, completely unfiled. Nothing digitized, just on the floor, basically. And so if one were to want to try to do a study of the catalogs of all the data from all of the machines, someone would have to go and scan stuff that's just laying on the floor, completely unfiled. Now, would they do that? Yeah, if someone put a request and did a FOIA request related to an NIH grant, I guess they'd be compelled, but they'll get back to you 100 days from never. So that's unfortunately a problem. It's not a wonderful thing, it's just a reality. Now the next issue is that gold standard data is not always reliable. It's based on human observation, a flawed study design, etc. So again, there has to be some cooperation. There has to be some human desire behind it. Now let's talk about experimental data. Experimental data types that show promise for public health tend to be crowdsourced and geolocated. They're controlled by private sector corporations. So there is something proprietary. They may not necessarily want to share. There are privacy issues. There's intellectual property issues. Their popularity is predicated on protecting that end user privacy. If people feel like their anonymity is going to be compromised, they may not necessarily want to share data with a university, knowing that data may end up in the hands of law enforcement. They may not want to hand that data over knowing that potentially that data may be used in a lawsuit against them later. The competitive edge of an app developer or a platform developer may precisely be that their competitors can't get access to the data that they generate. One of the biggest issues that I have as a researcher is that companies that do produce data and even share data do not want me to be able to export that data into comma separated value files, or specifically try to find a way to lock me out because they know I'm a researcher. So they'll say, well, if you were an entrepreneur, or you were a this or a that, or a marketing guy, I'd let you. But because I know you might publish it in a peer-reviewed journal, no way, because my competitor might find out what you're doing. So even on the private sector side, there are concerns, and in fact, it's just the reality of trying to get data. It's understandable they want to protect their competitive edge. So now what I'd like to tell you is, after giving you that very, very long preamble, and I thank all of you for keeping your eyelids open, how do we get to CHP? We went in the front door. We decided that CHP had a very large likelihood of having data about outcomes. They were likely to know if someone was in an ambulance or not, and we wanted to figure out how we could get access to finding out who's in an ambulance or not. And we asked some students at UCLA, Dr. Young asked some students to find out, do some little digging around to find out who at CHP might know about that. They came back and said, nobody knows. So I had a brilliant idea. Why doesn't someone just go to a local police department of CHP in Los Angeles, walk in the front door and ask if anyone knows what CHP's mission is? And lo and behold, someone by the name of Sergeant Starkey was willing to actually come and talk to our students and actually do a conference call with us and walk us through CHP's mission and tell us about their technology and tell us about exactly what they do for the state of California. And it completely changed our lives at UCLA. And it made everything great for us, and it inspired our students and inspired, I think, our institute and reinvigorated us. We got an opportunity to talk to Sergeant Starkey and learn about their enforcement process, and I think it made those of us at the Institute not only become excited about our work as researchers, but want to have an opportunity to contribute to CHP's mission as well. As part of that, we had an opportunity to be introduced to Commander Jae Song, who invited us to be part of this panel, which was an unbelievable opportunity. We had an opportunity to learn about Commander Song's path and journey through CHP, as well as the opportunities there were to learn about data. He identified for us some publicly available data sets that simply, if you tried to navigate CHP's website, you would never find. The point is that the data is there, but if you go to practically any California governmental website as a normal human being who just visits the website, you will simply never find it. If you search on someone's website, I mean, I say this, forgive me, I'm just being frank, if you just go onto, the CHP's website and just search data, it's just not obvious. So Commander Song just frankly pointed us to the correct link. We found it, and lo and behold, we were able to do some case study. And what we were able to find was that if we took several other social data types, for example, Twitter and Google Trends, we were able to make some very valid comparisons. The initial comparisons were not as exciting as we hoped, but they were not useless. They were useful enough to tell us that indeed people were posting information about highway accidents on Twitter, and people were searching about highway accidents on Google before an accident. But they weren't doing it considerably fast enough. So the next thing we had to do was find something more meaningful. And the obvious place to look is where their eyes would be, and their eyes were on their phones. So who had those eyeballs? And the answer was Waze. Okay. At that point, we approached someone at Google. Our friend, Adam Fried here, will tell you about that experience. He'll be the next person to speak. They have a program called Connected Citizens, which specifically works with law enforcement. And at that point, after we were able to produce a case study with Dr. Young that demonstrated the actual benefit of providing predictive analytics that showed that Waze could actually contribute to CHP, the two parties were able to work directly together. Ultimately, we were able to offer the results of our case study, maintain confidentiality for both parties, and we were able to generate a genuine public-private partnership for both parties as a neutral party. That's the role of a university. I just want to thank all of you very much for listening to what I had to say. Here's my email address if you'd like to reach me. If your agency has a mission or your company has data and you need some university partner, we're here for you. Thank you very much.
Thank you, Dr. Bychkov. I just want to make one comment. This is the power of citizen engagement. The society is changing. The way we provide public service, the environment is changing. The people just knock our door, come over, we want to help you. It's not that they want to get something from you. So this is a great example of what we call community-based and academic-supported outreach partnership from UCLA to CHP. One thing I wanted to put some disclaimer is he gave us more credit than we should be because he's the one, UCLA is the one doing all the work. So basically for CHP, we just provided the data which already published to our news agency, News 10, News Channel 3 for our online traffic reporting. So we basically just provided the existing information. I didn't even, from my wildest imagination, they're gonna come out of anything because I got a constant feedback that people prefer to use Google Map to monitor traffic instead of use our webpage, because our webpage might not be that user-friendly, but the information, like I said, is gold standard, it's accurate. So anyway, so I just provided the information without doing anything extra. And it's amazing what they found the result for us. And this is just like a beginning of a partial, what I call formation process, because we began to see what will happen